Hi everyone! Welcome again to my YouTube channel. It's me, your nurse educator and lactation consultant now na magbibigay na naman sa inyo ng panibagong knowledge about breastfeeding. So, marami na akong breastfeeding videos na nagawa. Na-explain ko yung mga problema talaga ng mga moms about milk supply. But this one is kind of different because not all healthcare providers, lalo na yung hindi mga lactation consultant na hindi talaga nila alam kung ano talaga ang isa sa mga signs na nag-i-struggle ang mga moms about milk supply. So, i-explain ko sa inyo talaga kung ano yung mga sintomas or mga signs na magbibigay sa inyo ng clue na baka later on magkaka-problema kayo about milk supply. Na malalaman nyo na ganito pala, kaya pala konti lang yung milk supply ko dahil ganito. So, i-explain ko sa inyo kung ano talaga yung titingnan nyo sa anatomy ng breast ng isang babae. At sometimes, it can be predictable na maybe later on pag nanganak ka na or in terms of nagbe-breastfeed ka na, maybe there are cues or maybe signs that you have to keep an eye on that maybe can affect your milk supply. So, isa sa mga natutunan ko talaga as a lactation consultant, kasi pinag-aralan talaga as a lactation consultant, talagang lahat ng problema ng breastfeeding, either anatomically in the breast or physiologically na yung function ng breast, talagang pinag-aralan namin isa't isa. So, one thing that I want to share and give you some hints, lalo na ikaw ay planning to get pregnant, or you're pregnant right now, or you're breastfeeding right now, and you're struggling with milk supply. Dahil ito talaga ang one of the number one problems of moms with breastfeeding. Now, kung may time kayo after this presentation that I'm talking, I want you to maybe go in your bedroom or go to the washroom at i-check nyo kung ano yung gustong ipa-check ko sa inyo, okay? In terms of your anatomy of your breast, okay? Now, when you look at your breast, later on, or you can do silip, okay? If you want to. So, kung ikaw lang mag-isa, do it on your own. You can check it while I'm talking, okay? So, when you are looking at your breast right now, na medyo may duda ka, okay, do you think I can produce lots of milk pag nabuntis ako or pag nanganak ako? O if you're breastfeeding right now, bakit kaya maliit, konti lang yung milk ko? So I want you to look at your breast. If you are alone yourself, or if you go to your bedroom later on, when you look at your breast, okay, I want you to look around this areola part. Yung areola natin, yung surroundings ng nipple area natin. Okay? So, I want you to look at this part. Tatayo ako, okay? I want you to look at this part around your breast. Okay? This is the so-called areola. Ito yung nagda-dark ang kulay when you get pregnant. Okay? If there's any changes to the color, pag nag-change yung color ng areola natin, it's a good indication in breastfeeding. Now, take note. Minsan, kung let's say you are Asian, right? Minsan, kalimitan ng skin texture natin is a brown, at ito'y minsan nagto-turn ng really darker brown, o minsan din darker purple na kulay when you get pregnant. If there's any changes ng color, this part, that means it's a good indication that you may have good milk supply. Again, that changes to the color, okay? Now, another indication that you may have abundant milk supply if you notice a big changes on your breast size. Okay, the breast size that I'm talking about, normally your breast size changes by trimester, okay? You may notice the changes of your breast size around maybe the middle of trimester of your first trimester, and then it goes bigger and bigger. If you do notice changes doon sa breast size mo, okay, it go bigger, that's also a good indication, a good sign that you may have abundant or good milk supply later on when you gave birth. So every time I do breast assessment or a maternal assessment while they're pregnant, I will always ask na, did you notice any changes to your breast size while you're pregnant? Pag sinabi ng mom, no or yes, yes is a good indication that you may have good milk supply later on. Okay? Now, that's another indication of good milk supply. Now, what else is most important that you need to observe? Look around your breast. Another indication that you may have good milk supply when you give birth is when you see lots of Montgomery glands. So, where is Montgomery glands? Yung Montgomery glands, the Montgomery glands is the little dots. If you can see little dots around your areola. So, sometimes some women will have 20, will have 30. You can see it around your areola, little dots. Now, that's so-called Montgomery glands. Now, ano yung Montgomery glands? Anong function nun dito sa breast natin? The Montgomery glands doon sa around your areola, yun yung nagbibigay ng scent, amoy of your milk. The scent of your milk comes out in that Montgomery glands. And guess what? When you give birth, after you give birth, and your milk come in, you may notice na doon sa mga Montgomery glands mo, doon sa mga little dots na may mga butas-butas ng konti, minsan may lalabas din na milk doon. Okay? The fluid or the scent or that comes out inside the Montgomery glands, yun yung magbibigay moisture around your breast. Okay? See? So, itong mga sign na to, minsan hindi ito na-explain ng mga doktor eh. Hindi nila ma-explain na bakit kaya si mommy kulang ang gatas o mommy is lacking of milk supply. Because these are some of the most important signs na kailangan mo talagang malaman while you are pregnant or while you're breastfeeding or kahit na hindi ka pa buntis ngayon. Because if you are planning to get pregnant someday and you have your own family, you need to know, kaya ako ginawa itong video na ito, that's the main reason why I'm doing this video, because there are so many women out there right now, they're already been moms for how many times, that they didn't know this. So that's the main thing, that it is important that you need to know these cues, these symptoms, these signs, na indicators of can you make lots of milk? Why there's some women who cannot produce lots of milk? What are the reasons why? What are the reasons why they don't have enough milk? And they did not know this, that this is sometimes the anatomy of our breasts can also affect on how we produce our milk. So, kailangan maintindihan natin yun. Kailangan, we need to know these things. And I want you to share these ideas, this information to some of your friends or family members who have problem with producing milk or who are thinking of getting pregnant, so that they already have some ideas that you never know. You may have abundant milk supply, or you may not have abundant milk supply because, again, of the anatomy of your breast. Now remember, every person is different, okay? There are some women who probably did not have tons of Montgomery glands, but still produce lots of milk, okay? And there may be some women who have tons and tons of Montgomery glands, but they don't have enough milk supply, because again, it is also because one of the important factors that can affect your milk supply is also your total physical health. Hindi ibig sabihin na hindi perfect yung anatomy ng breast mo, kaya wala kang gatas. There are also some moms na hindi din nila ito alam ng iba, okay? Na when you have a regular period nung bata ka pa, when you were younger and you have a regular period, irregular means you don't have monthly period all the time. You may have skipped 3 months no period or 2 months no period when you were younger, and that's the indication that you have some hormonal issues or problem in your body. Every time a woman will have hormonal problem, either thyroid problem, hormone, any hormone problem in your body can affect on how you make milk. Okay? So, isipin mo, when you were younger and you have a baby now, and you have concern that you don't have enough milk, think back doon sa bata ka pa. Regular ba lagi yung period mo? Some women with endometriosis will have problem with making lots of milk. Women who have some problems with their ovaries. Again, the irregular periods is also an indication that you may have problem later on producing lots of milk because of the hormone problem. So I hope this information that I shared today about the anatomy of our breasts and what you look for in terms of milk production, it's important na alam mo yung mga indicators para you can be prepared someday when you have your own baby or someday when you plan to breastfeed na, oh, kaya pala mahina yung gatas ko, kaya pala no matter what I do, konti lang talaga yung gatas ko kasi may problema ako noon sa period ko, o may problema ako sa thyroid hormone ko, or yung breast ko ganito pala na I don't have any Montgomery glands. May nakikita ako, believe me, in my nursing experience when I was doing a breastfeeding clinic, I've seen women na walang Montgomery glands. Talagang totally plain. Very, very fine yung skin texture nila. Wala ka talagang makikitang Montgomery glands. And guess what? They really struggle with milk supply. And again, as I mentioned this before, it's not on the size of the breast, an indicator of having milk supply, okay? There are some women who have smaller breasts that have tons and tons of milk. There are some women who have bigger breasts who don't have enough milk. So it depends on every woman. We're all different in our own ways. Our anatomy, breast anatomy differs from one another. So never compare what you have to others. At least you have some ideas now kung bakit kaya some women are struggling with milk supply. So this is very important information on indicators for Montgomery glands, indicators for changes of the color in your areola, indicators for the changes of shape, the changes of the size of your breast while you're pregnant, and also the problem when you were younger about your period, or if you have hormonal problem, if you have thyroid problem. So these are risk factors that can affect on how you someday produce the milk when you're breastfeeding. So I hope isa na naman itong lesson na matutunan ninyo, na hindi nyo matutunan siguro sa mga doctors nyo. Because to be honest, hindi lahat, sinasabi ko to, hindi lahat ng doctors alam lahat about breastfeeding. Because again, it's not their specialized area. So, I am very happy to share these ideas para may mabigyan kayo ng kaalaman. And you can share this knowledge to other women who have no idea of what's going on in their body, why they're struggling with milk supply. So again, it's very important to check your breast right now, and maybe you can find something, and feel free to do comments. If you have any questions, feel free to ask me questions because I'm here. Follow me in this journey. Please make sure you subscribe because I'll be sharing so many important evidence-based information